Welcome to Journey to 600. We are back again today talking about special tests with an emphasis on the knee joint. Breaking it up into categories, we're going to be talking about ligaments of the knee, meniscus tests, and then patellofemoral tests. So for ACL, the two main tests for that is anterior drawer test and Lockman test. So typically the mechanism of injury for the ACL is normally non-contact due to pivoting, cutting, sudden stop, landing from a jump, or hyperextension. Both of these tests are just looking for excessive anterior translation of the tibia or the lack of that firm infill that you should normally feel, and you can compare this bilaterally. The Logman test is the gold standard for ACL special tests, but the anterior drawer test does have a good specificity to help rule in PCL. The mechanism of injury for a PCL is typically falling on a flexed knee or what we call a dashboard injury. Again, that's just re-emphasizing that you have a flexed knee and there's some kind of trauma. The test that you would likely do is a posterior drawer test, which is set up just like the anterior drawer, but you're going to be providing that posterior stress, and you would see that the patient has excessive posterior translation of the tibia or a lack of that firm infill. Next, you can also do a posterior sag sign, so it's more about just setting them up in this position and looking to see if the knee is sagging or not. MCL and LCL, I put these together. They are both on the medial and lateral side of the knee, and the tests sound similar. You have the valgus stress test, you have the varus stress test. The MCL mechanism of injury is typically contact with a direct blow to the outside of the knee, which stresses that MCL, but the MCL can also be due to a non-contact injury, such as cutting, pivoting, or deceleration. LCL mechanism of injury, on the other hand, is going to be a direct blow to the inside of the knee, but it can also be a non-contact injury due to tibial external rotation on that planted foot. Positive tests for these are just going to be that they have the joint line pain, respectively medial or laterally, or they would have increased laxity when compared bilaterally. So you will perform the stress test in full extension as well as in a soft knee bend of 30 degrees of knee flexion. So those are all the ligament tests. Getting down to the meniscus. So you're going to have 3 meniscus tests that we're going to talk about today. First off, the mechanism of injury for meniscus is typically traumatic for the younger population, and it's going to be due to pivoting, twisting, or changing in direction, which sounds like a familiar mechanism of injury for the knee. These special tests are going to be the key to determining what their injury is. And some of these injuries don't occur in isolation, so they could have multiple positive tests. But we're going to talk about McMurray's, and this is a highly specific test to help you rule in that it is meniscus. A positive test will be a palpable or audible click or pain over that joint line. And Apley's is going to also stress the meniscus, but it's going to be in a prone position with distraction and compression forces along with rotation. And then Thesley is going to stress the meniscus as well, but it's going to be in standing, weight bearing, and giving some rotational force in standing. Lastly, patellofemoral tests. So although these are grouped together, they're not going to be identifying the same thing. Like all the ligament testing were for specific ligaments, all the meniscus were pointing to meniscus, but there's a lot of reasons why someone might have patellofemoral pain or dysfunction. So patellar apprehension is typically used to assess for patellofemoral hypermobility or instability. A positive test would be that the patient feels like the patella is going to dislocate, or the patient might contract their quad to help bring that patella in to prevent or to make it feel more stable. or you could even see some grimacing on the patient's face, hence the name apprehension. You would do this test if a person has a history of patellar subluxation or dislocation. Patellar tilt is more to assess tightness of the lateral knee. While a positive test is that it is tight, you could also see some excessive elevation, which may indicate patellar hypermobility. Lastly, the McConnell test is going to assess the articular surfaces of the patellofemoral joint for chondromalacia or looking for patellofemoral pain syndrome. So this one is basically an MMT of the quad at different angles, and you're looking for pain, and at the angle that it has pain, you're going to apply a medial glide on the patella to see if that helps reduce the pain. Now we are down to the practice question. A patient reports posterior knee pain after falling on a hyperflex knee. Which of the following tests would be positive? A. McMurray's test, B. valgus stress test, C. bounce home test, D. posterior sag sign. I'll give you a minute to look this over and determine the answer. So let's talk about what this case is asking about. So it says, which of the following special tests would be positive? Going back to the beginning, we know it is a knee pathology since the patient has posterior knee pain. Next thing, you have to recall what injury might be caused by falling on a hyperflex knee. If you don't know, then you can go through the answers to see what the special test is testing for. So, McMurray's, I know that tests for meniscus. Valgus stress test, I know that tests for MCL. Bounce home test, don't know that test. We didn't discuss that today, so we'll come back to that. Posterior sag sign. Oh yes, that tests for PCL. So going back to mechanism of injury, so a meniscus is going to be pivoting or changing direction, so that's not in the case. MCL is typically a direct blow to the outside of the knee, but it can also be due to pivoting, still not in the case. PCL is caused by falling on a hyperflex knee, so yes, that is in the case, so I definitely think it's PCL, and I think the correct answer is sag sign, and it is. But going back to the bounce home test, so when you take boards, you may not know every single answer choice. Sometimes you just have to rely on the things that you know to help you rule out. Although this question is complex because you have to think about mechanism of injury and then you have to think about what is a special test. So bounce home test is actually another test for meniscus, but say you didn't know that, you would really have to rely on that you know that the PCL is damaged due to a hyperflex knee injury, and a test for the PCL is a posterior sag sign. But if you had narrowed down to C or D, or any two answers, that gives you a 50% chance of getting it correct. But now you know that bounce home test is a test for meniscus, so you can't forget it. Thanks so much for watching, and be sure to like this video, subscribe to our channel, and turn on your notifications. We will see you next time on your journey to 600.